stenosis. Now, in my previous video, we have spoken about spinal stenosis, so I just thought I'll come here and talk about the causes because there can be various causes of spinal stenosis. Now, whether it is a stenosis that's in your back or in your neck, there can be different reasons for this problem. And once you know the cause of your spinal stenosis, you can work with your doctor, your physiotherapist, or your healthcare professional, and you can be an active participant in your treatment. So, if you did not watch my video from last week, let me just quickly give you a synopsis of what is spinal stenosis. Now, spinal stenosis is basically a narrowing. Stenosis means narrowing. So it's a narrowing within your spine. Now, this can be centrally along the canal, the spinal canal where your spinal cord is passing through, or it can be at the level of your facet joints, so on the side of the spine, that is known as a foraminal stenosis. If you want to know the details of these two kinds of stenosis, you can go to YouTube and you can type my name followed by spinal stenosis, and you will be able to see the video that I did last week. Now, before we get into the topic of the causes of spinal stenosis, for those of you who don't know me, my name is Swati. I'm an executive mom power coach. I help moms of younger kids who work in high stress executive jobs manage the aches and pains that come along with their motherhood journey. Now, what that means is basically spinal, that is back and neck, or joint pains that they have either during the pregnancy, childbirth, or the earlier toddler years. Now, I help these moms with easy exercises, lifestyle changes, tips, and tricks to manage during their everyday activities and during their work life so that they can manage these aches and pains better, be a better professional, be a better mom. All right, so going back to the topic for today, what are the causes for spinal stenosis? Now, if you have spinal stenosis, one of the main causes of spinal stenosis is degenerative disc disease. Now, what this means is that you have a degeneration in your disc, so normal wear and tear that comes with age in your disc. Now, disc is present between every two vertebrae throughout your throughout your spine, all the way from the base of your neck down to your tailbone. So these discs can get dehydrated or they can shrink up as we age and as they undergo degeneration. When this happens, the space between the vertebrae narrows, and when this space is narrowed, it can lead to narrowing of either the spinal canal, or it can affect the side joints, that's the facet, and lead to spinal stenosis. A similar thing happens when you have a bulging or a herniated disc in your spine. Now, this bulging or herniated disc can actually impinge on your spinal cord or on the nerves that exit from the side of the spine, and they can lead to spinal stenosis as well. Now, if you have arthritis, that's osteoarthritis or spinal arthritis, one of the features of arthritis in the spine is that you have bony spurs or osteophytes. When these bony spurs are jutting into your spinal canal in and around your facet joints, they can lead to compression or irritation of your spinal cord, of the nerves around there, leading to, again, spinal stenosis and nerve pain kind of symptoms. So, when you have nerves exiting, for example, from your neck, they go and supply your shoulder and all the way up to the tips of your finger. Or when you have nerves that exit your lumbar spine, for example, the sciatic nerve that exits the lower lumbar spine, and it supplies your bottom, your buttocks, all the way down to your toes. So when this nerve is irritated in the lumbar spine, you will get symptoms in the area distributed by the sciatic nerve. It's also known as sciatica. So uh, if you this can be also one of the causes. So you see, there are multiple causes. Say somebody's had a trauma, a road an accident, a car accident, or they've had a fall from a great height. Now, this can lead to trauma or fractures around your spine, which due to which the spinal canal through which your spinal cord is passing through can have a bony fragment jutting in, or it can just the spinal canal is not the smooth round shape that it usually is. Because of that, there can be a pinching on the spinal cord. So there can be many reasons. Another reason I would say is not very popular, but it is possible if you have spondylolisthesis or listhesis. Listhesis is basically when you have two vertebrae. So these vertebrae are stacked on top of each other, right? So they're supposed to be here with a disc in between. Now when one vertebra shifts over the other, that is known as listhesis. So if, say, there is a backward displacement of one of the vertebrae and it displaces into the central spinal canal, it can pinch on your spinal cord. Or if, say, you have a facet joint arthritis. Now facet joints are present on either side of the spine, as I mentioned earlier, and if these facet joints have arthritic changes, they can be putting pressure onto the nerves that exit these facet joints. So again, you will have nerve pain like symptoms. So these are the different causes. I mean, there can be many other causes, but these are the common ones that I wanted to cover. And yeah, or if you have, say, a spasm in the area, sorry, a swelling in the area because of your trauma or fracture, that itself can lead to a temporary kind of effect. I mean, it's not something that's permanent. Once that swelling goes away, the effect also goes away, but that can mimic uh, a spinal stenosis, right? So if, say, I have an injury around my facet joint, or a fracture around there and there's a lot of swelling, or I have a bulging disc and there is a lot of swelling in that area, it is possible that the nerves get irritated due to this swelling. And because of that, you might have foraminal stenosis kind of symptoms. All right, so this is what I wanted to cover in today's video. Very quickly, when you go to your doctor, if you have, depending on what problem you have because of which you're getting a spinal stenosis, your doctor might ask you to go for an x-ray. Suppose you have a fracture or trauma to that area or arthritic changes, they might ask you to go for an MRI or a CT scan, or they can even do a myelogram, which is basically you inject dye and then you do a scan in the area. This could be, if there's pressure on the cord, say there is there's a tumor that is exerting pressure on your spinal cord, so then the doctors will send you for investigations. So the causes are very variable, but once you know, for example, if you know you have a disc problem because of which it is impinging on your spinal cord and it is creating these symptoms of spinal stenosis, then you can work with your doctor to address that disc issue so that you can minimize the spinal stenosis or manage your spinal stenosis. So it is good to know the causes, because sometimes it can be very overwhelming when you think, oh, I have a disc issue and a spinal stenosis. It's usually the case of, I have a disc issue because of which I'm getting a spinal stenosis. So you see, the understanding the cause is very important. All right, so if you guys are looking for some simple solutions to manage your back pain, this is a training that I'm going to do in this month in my free community. If you're watching this anytime in the future, the training will live there forever. So you can join my community and you can access the training at any time. Last month, we did a training on simple solutions to manage your neck pain. So if you have neck or back pain, you can join my free community. You can access the trainings there. And yeah, if you have any questions for me, any comments on this video, do drop them into the comments below. And if you want to join my free community, I'll leave a link in the description of this video. If you're watching me on Instagram, the link is in my bio.